Hi, this is your Houston chiropractor, Dr. Gregory Johnston. We got Matt and Connie back in here with us today, and they are engaged to be married, and they both came here from Los Angeles, California to get chiropractic adjustments this week, twice a day for 3 days in a row. Matt did. He's been getting twice a day. Yeah. Connie just got her very first chiropractic adjustment yesterday here at the office, and Connie had been suffering from severe headaches for 20 years, I believe you said, right?
Yes.
And have you had relief of your headaches already in one visit?
Definitely.
Yeah. Have you had headaches since we adjusted you?
No.
Isn't that great? Nice to live life without headaches, huh?
Yes.
And Matt, you probably know Matt's story. He's been back here a couple times a year getting his lumbar disc and spine adjusted so that he can avoid having to see the spine surgeon again.
Yes.
Because they've been wanting to do surgery on him for years now, right?
Yeah.
And we've been pretty much keeping that at bay with your adjustments.
Yeah, this last time was, it was a pretty bad road. Came back here in a wheelchair.
Well, you came in, you were in a wheelchair.
And I was stuck in a
antalgic posture.
Now.
Well, I mean, you're lined up pretty
now
good here
pretty
today.
Good. It's just my foot.
He's got a little bit of heel weakness on his heel walk, and that's kind of half of a foot drop. He can stand on his tiptoes, walk 3 steps on your tiptoes.
Oh.
So he can do that. He's got strength in that. That's S1. But when you do this one, L5, you can see his right foot doesn't have the same strength that his left one does, and it kind of falls down. That's called a positive heel test, and that's half of a foot drop. So actually, when you had it last time, you couldn't stand on your toes either.
Yeah, at all.
So we've made some improvements in his neurology from adjusting his lumbosacral spine and sacroiliac joints, and we've kept him off the surgery table. This is your 5th year of coming back here?
Yeah, it'll be 4.
4
it's
years?
Going on 5 years.
Yeah. But you already had back surgery back in what year?
Twice.
Twice now.
Yeah, twice in 06 and 09, and then I came here at the end of 17, and when I messed up again. And then you seen that the first video of that.
Oh, yeah.
One, I was all.
Oh, you were all
like
bent
that,
over, antalgic and suffering.
That one, I was every time I come out here, it's good.
Well, that's why you keep coming back here instead of going out there and having stuff done, right?
Yeah, I'm like, oh, I got.
And he brought his love, Connie, here this time because she's been suffering with headaches. So we're adjusting both of them now.
Yeah.
And man, I'm sorry to tell you, but ladies first always.
Okay.
So we'll do Connie first. Now let's take a look at you here first, Connie. Okay, I'm gonna have you close your eyes and bend your head forward and backwards for me. No new trauma or accident since this morning, right?
No.
Okay, good go. Look how straight your head is right now.
Yeah.
You notice you're not tilted over anymore?
Mm-hmm.
Okay, so we're gonna ring ding you first. Your favorite.
Yes.
It is really most people's favorite adjustment.
I like it.
Yeah, I like it too. There we go. So, getting rid of these headaches will mean what to your life?
I'll be able to do a lot more. Enjoy the summer.
Mm-hmm. And Connie's a nurse too, so she's doing patient care out there in California, correct?
Yeah.
Matthew violated our no phones policy.
Dad finally.
No wonder you got a headache.
That's my number 1 trigger.
That's your number 1 source, huh? There we go. But at least he brought you here to get it fixed.
Yeah.
Now, I can't vouch for his other stuff that gets you a headache.
Right.
There we go. Lift your head up for me, huh? There you go. Yeah. Keep your teeth together. Don't bite your tongue. Mm-hmm. Boy, oh boy. That should be getting easier for you.
It is.
Did you feel that one all the way down still? Good. I didn't even pull that hard this afternoon.
The second one I felt more, but
Yeah,
this one
deeper.
felt good.
Mm-hmm.
Oh, I love it.
Okay. Yes, ma'am. Boy, crack addicts already love you. We got Connie's first video up. I think this afternoon around, it was scheduled at 2:30, it came up. So you can watch that, and then her and Matt together on this video. We're gonna adjust them both in the same video. Since they're engaged to be married, we're gonna get them used to doing things together. So you don't need to tell me here.
Get to walk the aisle straight.
Yeah. So Renee, I made sure we're gonna get an invitation.
Of course.
I'm adjusting her left SI joint right now, and now her right one. The sacrum, straight superior to inferior. L5, straight P to A. L4, straight P to A. L3, P to A with a little bit of I to S, inferior to superior drive. And then I get L1, and you see the line of drive increases towards the inferior to superior line of drive on that as well. So that we can, I better quit talking, they'll get mad at me. Crack addicts love their cracks. If I talk over their cracks, I catch it. Does that hurt at all?
No.
That's great.
Yes. I could take a nap right now.
See, one of the big things also, whenever you see someone that has cervical genic headaches, which is what I thought she had when I did her history and exam yesterday. Let's turn on your back now, Connie. Is when an individual loses the cervical lordosis, or the forward curve in their cervical spine, and it straightens out or reverses, that puts a lot of tension on the spinal cord and causes tethering of the spinal cord, which is a stretching of the fibers. And you're not getting a normal nerve supply from your cervical spine up into your brain. So we're just clearing that up, putting the curve back into our cervical spine with that PDA adjusting. And then this adjustment here, I'm also working on the cervical lordosis by bringing her whole head up and over her spine. So now her ear's back here over her shoulders rather than being back out here in front with the clavicle. Because remember yesterday your posture was forward?
Yes.
Just put both arms out. She looks down a lot with their patient care and charting. There we go. Okay, one more. That's it. Okay, you can relax your hands right there.
I'm gonna laugh at you, Matt.
There we go. Yeah, he's next though. Watch.
I'm gonna get that elbow in.
Uh-huh. Let go. There we go. Gotcha. I'm hanging on to that one.
Yeah.
Let me help you up here. Don't worry, I don't have any limbs in here either. No spare body parts around here except for Bones over there. Bought him in the Palmer Library. There we go. We had a little boy come in here with his parents a little while ago. And he goes, there's some bones over in that corner. He goes, that's scary. I said, yeah, his name's Bones. He's not that scary though, see, he's smiling.
I've been smiling since.
Yeah, that's nice to smile like that without
Yeah.
pain, huh?
Connor giggles.
The
There you
whole
go.
time, I
Cool.
like he did different.
That's great.
It's like, oh, I can't believe it.
Yeah.
So if these headaches are put at bay and you're not going to get these anymore,
Mhm.
would you call that a life-changing experience?
Definitely. Every day with a migraine or a headache. It's
Yeah, for
misery.
20 years,
Yeah,
that's a lot.
a lot.
Okay. The drug manufacturers will hate to see you get well. Yeah, that's the great thing about chiropractic care is we do not use drugs or surgeries, which are fairly invasive and not really that healthy for you to be taking anyway, because it's really just hiding the symptoms. It's not fixing anything.
Yeah.
Didn't fix your headaches all 40 years, right?
No, it just
Put them at bay every once in a
meds
while.
all the time.
And then it's quit working probably effectively.
Yeah, it was.
Okay, bend your head forward and backwards one more time. Very nice. Take a look. You're right down the gut everywhere.
I know, I feel great.
Shoulders squared off. So what would you share with our crack addicts worldwide about your experience here this week, getting chiropractic care rather than doing the medical procedures?
I say it's the best thing you can do. You can't go wrong with trying it, and
Yeah, no harm in trying it.
no, at all. It's
Because you
worth
never
it.
know until you do try.
Exactly, it's worth it.
Yep. And you were a little bit scared at first, especially as a
No.
ring dinger, huh?
Yeah, it's nothing to fear. It's the best.
Yeah, that's cool. Well, thank you for sharing your experience with
Thank you.
everyone on your first chiropractic visit here to Advanced Chiropractic Relief. And now, Mr. Matt. Matt was in our documentary, by the way. He's the guy that came on right before Sub-Zero.
Oh, yeah.
And that documentary, if you want to watch it, is Who's Your Doctor? Choose Chiropractic First. That's the name of the documentary, Who's Your Doctor? Okay, Matt, let's show them what you're looking like this afternoon. No new trauma for you either, except no eating pizza, huh?
Yeah.
Okay. Hey. Alright. There we go. You guys flying out today or tomorrow?
Tomorrow.
Okay, good.
Get a good night's sleep.
And then there you go.
Take off.
You should go out and party while you're here. You should
Finally
go out and
nice.
party while you're here in Houston because there ain't none of that out in California anymore.
No.
But everything's opened up here in Texas now.
I think there's some spots that are.
Are there some underground places?
Yeah. But today's the first day. Right?
Not everybody out in California snowflakes, are they? There's a lot of them out there though. There we go.
Oh, Jesus.
Yes, sir. You're not gonna get away now, Matt. You might have me in here for the weekend. Okay, nice. Yeah. There we go. Now you probably saw the difference in the amount of force that I used for Matt's adjustment versus Connie's.
Oh.
I'm putting my strength and my weight into that one. And look here, he's
Oh,
got
hey,
patellar reflexes.
Yeah.
That's better actually.
Yeah, I didn't.
That's improved.
That's really good.
That is good. That is a significant neurological test, is the reflexes. And that's why I do it. I'm not doing that to show you didn't get paralyzed. I'm showing you the improvement in it.
Yeah, I remember.
Our crack addicts, they think I'm doing it because I want to show that the patient's not paralyzed.
Oh. Oh.
I've been doing this adjustment for 40 years and not one alleged injury in that entire 40 years on that adjustment. Not one. That's a pretty good track record, huh? A lot more people get injured on that side posture twisty adjustment than do that one, that's for sure. Because that hurts almost everyone. There. Now Matt's got some scar tissue right down here at L4 and L5 and sacrum, which is why I stick my elbow deep down in his quadratus lumborum multifidus and erector spinae muscles. And if my elbow's not enough, I just use my knees. Jump up and down on them. But my elbow's pretty stout, isn't it, Matt? Uncle. All right. He's a sport. We love Matt. Yes, sirree. Okay, let's turn you on your back. And Matt's been coming here so long, he's got all my lines down.
I'll knock them down and let them.
That's it. All right, slide down this. There you go. I think you're talking about beers, aren't you?
Oh, yeah.
Knock them down. I say knock them out. Yeah. A little different, but you're knocking them down. I can tell what you're thinking. Now this is an important aspect for helping get that disc pressure off too, which is why I do it from both ends. I'm decompressing the lumbosacral spine from the upper end with the ring digger and from the lower end with this leg adjustment. You feel that all the way up?
Oh, of course.
All right, good deal.
I remember I first came in, are you gonna pull my leg?
Yeah, well, it's just as important, isn't it?
Yeah.
You get a lot of relief from just doing that too. A lot of people do. In fact, that's a lot of people's favorite adjustment. You can't get out here without me pulling your leg and shooting you.
Yeah.
You knew that was coming, didn't you? All right. There we go. Okay, let's come over this way. Ooh, look at you standing up straight. Look at all that space now.
Yeah.
That's much, much better, man. Yeah, you're not all deviated like you deviants are.
Oh my gosh.
I just can't resist. There you go. All right. Show them what you got now, Matt. So if you're watching this, you knocked out a few of them for Matt, and you knock out a few of them for me, and then you come in here and get realigned here and go have a beer with Matt. So what would you share with our crack addicts worldwide about your experience here over the past 5 years?
That nothing compares. That's why I keep coming back, and I don't want to get surgery. So this keeps getting me right. I just gotta listen to Doc and my body.
Do the homework a little bit more.
To come in when everything's going good, not be like, oh.
Yeah, don't be chasing the pain all the time.
Yeah, because.
But you've done a lot better job of doing that, by the way.
Yeah,
He's
usually.
taking more initiative on that, huh?
Yeah, usually.
He's not so bad now when he comes back for his tune-ups, which is great because if you stay on top of it, it doesn't get on top of you again.
Yeah.
Which is a great thing.
That's how this time has been.
Yes, it is. I'm proud of you
Yeah.
for doing that too. And we just tell our patients to listen to their bodies. It'll tell them when they need a tune-up. We don't schedule patients 3 times a week for 6 months or any kind of schedule like that. I see people 1, 2, 3 times, or if they're coming in from out of state, I'll see them twice a day for 3 days, which is what we've had Matt on the last few times he's been here.
Yeah.
What else would you have to share with them? Is it fun coming in here too?
Oh yeah,
You get to meet a lot of cool people from
Yeah.
everywhere too, huh?
A great time.
Yeah.
It's all, every time coming in here.
Yeah, we have a lot of fun with our patients. Our patients are our family. We love them, and we take care of them just like they were our family. So, this is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief with Matt and Connie from Los Angeles, California. Say congratulations, they're gonna get married. Show them your ring, Connie. That's beautiful. There you go. You got matching tattoos, don't you?
Not yet.
Not yet. Okay. Okay, Renee's telling me to wind it up. She's so bossy and she's a little slave driver. We'll see y'all soon.
We should have got her in there too.
Yeah.